come to that in just a moment to talk about ICU beds. The French spent many weeks in lockdown. We see the resurgence, which seems to be going on and on. You've got several options, either a renewed lockdown, a lockdown like some others have done in Europe, certain cities in lockdown, or curfew. For several days, people said you're opting for a curfew. Is that true?
Yes. But first of all, I'd like to explain to you why we're doing all of this. It's been said, if we have to react, it's because we have to slow the spread of the virus. First of all, to protect others. Sometimes ourselves. It depends who's speaking, but the elderly, the more vulnerable, and the poorer members of our society. That's our first goal. Secondly, we have to protect our health system and our healthcare workers. And then I'm speaking for all of our fellow citizens who are listening to us today, because we have heard in the last weeks people say, I'm not concerned by this, don't take away my freedom, I have the right to be infected. But this is not true, because we are a nation of citizens, and we're all linked together. And so even if I don't want to be altruistic, to slow the virus is also protecting my health, because if I don't slow the virus, if I suffer from another illness tomorrow, or if my brother, my sister, my mother, my father suffer an illness tomorrow, no one will be there to help them. That is our goal, to protect others. And our goal is to slow the virus and to make sure that these 20,000 cases per day, that this number is brought down to 2,000-3,000 cases per day, because that is a figure that we can control. 200 daily admissions to ICUs has to also be limited, so that we can lower the share of COVID patients in ICUs to about 70%, because that would be a number that can be controlled. So we do not want to impose a new lockdown. But what we want to reduce is contact situations, moments when we're off our guard, when we're spending time with people who are not from our household or our families, moments for friendship, for social interaction. That's why this is quite cruel in our management of the illness, because these moments of conviviality bring us too close together, and that's when we can infect each other. So this curfew is a measure that is relevant, and we saw its relevance in Guyana. What we did in Guyana allowed us to slow down the spread of the virus. But slowing down these social relationships allowed us to be efficient in Mayenne, it allowed us to be efficient in Guadeloupe, which was very hard hit, and this worked. And they've managed to slow the spread of the virus. So the decision that we've taken is that of a curfew that will be applied in the Île-de-France, the Greater Paris area, where the virus is spreading very actively, and in several large cities, 8 cities, which I will name, the cities of Grenoble, Lille, Lyon, Aix-Marseille, Montpellier, Rouen, Saint-Étienne, and Toulouse. The local representatives of these cities were contacted in order to organize this curfew. The curfew will last from 9 p.m. to 6 a.m. and it will start on Saturday at 0 hours.
How long will it last?
Well, the government has decided it will last for up to 4 weeks, and then we will see if it will be prolonged till the 1st of December. The analysis that we are doing is that if in the next 6 weeks we can, in those active circulation zones, see that the measures that have been imposed in the last few weeks, because all these cities have seen measures such as closed bars and other areas that have seen different constraints. If during these 6 weeks we maintain the curfew, and if we're all collectively responsible, if we do show that we're committed to reduce our social contacts, then I believe that we will be able to progressively reopen. I'm very careful here because our experience shows us that we can't be sure, but 6 weeks seems to be a good horizon. But I need everyone to understand the goal, the objective. We need to be able to keep having economic activity, to keep being able to work. Schools, high schools, universities have to be open and have to function properly. Our fellow citizens have to be able to work normally and have a social life, but this social life has to be reduced. And what we want to capture through this curfew measure is all the things that have stimulated the spread of the virus in these regions, meaning private meetings, parties, birthdays, moments of conviviality where there's 50, 60 people at festive gatherings, because these are factors that drive the virus.
Just to be clear and specific, at 9 p.m. in all those cities, we're talking about 20 million people approximately, all movies, theaters, restaurants, bars will be emptied. Everyone will be at home or on the way home.
They will close at that time, yes. But I think you need a lot of common sense with this and a very localized approach, because, of course, all these establishments will have to close at 9 p.m., but it depends on your specific situation. If you live next to the restaurant, you can go out at 9 o'clock. If it takes you half an hour, you'll have to organize your time to leave the restaurant at 8:30 instead of 9 o'clock. And there'll also be local consultations, because the situations are different around the country. The organization of our lives is different in Grenoble, Saint-Étienne, or Paris.
9 p.m., this is important. There are knock-on effects for restaurants, bars that are already hard hit by the previous measures, theaters, movie houses, and so forth. Will there be new arrangements to assist these stores, these operations?
Yes, you are absolutely right. We will try to help as much as possible, help theaters and cinemas, to help them to reprogram and to organize things so that people can go there earlier. I'm saying this because in many establishments, in restaurants and theaters and cinemas, we have set up rules together that mean that people are very protected there, because we reduce the number of people who can sit at one table in a restaurant, because we have health protocols that are very efficient in cinemas as well as theaters and operas and so on and so forth. So we will try and reprogram things to end a bit earlier, but of course there will be economic consequences.
Restaurants will have to close.
For example, in Paris, we know that if we impose a curfew at 9 p.m., there are restaurants who will decide to close. Now, we'll talk about economics, of course, but fully paid furlough leave will be reactivated for all these different sectors, for the hotel industry, restaurants, events, sport, culture, and so on. So up to 90% of basic salary will be guaranteed by the state, but they will receive their full payment. We have preferential systems that have been implemented, and from Friday in each of the cities we will start consultations with all the different professions that are impacted by these measures, and we will improve the economic response with these businesses. I'm thinking of restaurant owners, because they've made amazing efforts, and restaurants are part of the French art de vivre, and they will have to close because their overheads will be too high.